All right, guys, good afternoon. So we are going to teach asepsis and infection control today. This is a very important topic. We have a lot of information to cover. This is going to be the basis for a lot of the things that you apply in your nursing practice. So we're going to want to make sure that we know this and completely understand it so that we will be able to implement these in our own practice as nurses and LPNs. And I meant to say this the other day and I think I forgot, but just be a little bit patient with me when I'm changing the slides for each topic, because I am actually changing these slides in 3 places. I have a book that has my slides that I look at, and then I have my laptop that I have to change, and then I have this other screen over here, which you're seeing, that I have to also change. So it does take me just a little bit to get that done. So please just be patient with me. So what are our learning objectives for asepsis and infection control? So by the end of this PowerPoint, we will be able to explain the infection cycle. We are going to discuss the 6 components of the infection cycle, which is the infectious agent, the reservoir, the portal of exit, the means of transmission, the portal of entry, and then the susceptible host. We're going to describe nursing interventions that can be used to break the chain of infection. We're going to review the types of agents that cause infection, so bacteria, viruses, and fungi, and then we're going to determine how they're categorized. We are also going to be able to describe the factors that predispose patients to nosocomial infections and strategies that can be used to protect the patient in these situations. And then we're going to be able to list the stages of infections. We are going to be able to describe the phases through which an infection progresses. You have your incubation period, your prodromal stage, your full stage of illness, and your convalescent period. We're going to be able to discuss factors affecting the susceptibility of the hostess. For example, intact skin, age, sex, race, immunization, stress, fatigue, and invasive medical devices. We will be able to identify factors that reduce the incidence of healthcare-associated infections, identify situations in which hand hygiene is indicated, and we're going to describe strategies for implementing CDC guidelines for standard and transmission-based precautions when caring for patients. So there's a lot of new terminology associated with this topic that you guys may not have heard yet. These are listed in the front of chapter 24 of your Taylor book. And I highly recommend that if you do not know what these mean, that you look them up and understand the definition of them. Okay, so the first one is asepsis. We have bloodborne pathogens. We have the CDC, which is short for the Center of Disease Prevention and Control. We have communicable disease, colonization, endogenous, exogenous, hand washing, infection, infectious agent, medical asepsis, microbiology, OSHA, which is the Occupational Safety and Health Administration, standard precautions, surgical asepsis, systematic, transmission-based precautions, and lastly, vaccines. So I do want you guys to look these up. I want you to understand what they mean and how to use them, because as nurses, we have to talk like nurses, which means we have to use medical terminology in the appropriate way. We have to understand what it means, and we have to understand how to use it. All right, so what is the Center for Disease Prevention and Control, the CDC? I'm sure that after the past year that we've had, every one of you guys can tell me what the CDC is, because it's all we ever hear. But for the sake of today's PowerPoint, the CDC is a U.S. government facility that is responsible for investigating, preventing, and controlling disease. So they regulate mass immunization programs, they make laws concerning safe sewage disposal, they have surveillance programs for hospital infections, and they regulate for the control of communicable diseases. They establish regulations that help control these diseases. Then we have the Quality and Safety Education for Nurses, which is QSIN, and we did talk about this in our previous video earlier. So nurses are involved in implementing the goals that QSIN sets. So when it comes to infection control, we are involved in identifying, preventing, controlling, and teaching the patient about infection. All right. So components of the infection cycle. So an infection is a disease state that results from the presence of a pathogen. And a pathogen is a disease-producing microorganism in the body or on the body. An infection occurs as a result of a cyclic process, and it consists of six components. You can see this on page 597 of your Taylor book, figure 24/1. So we have the infectious disease, which is the agent that causes the infection. It can be a bacteria, a virus, a parasite, or a fungi. Then you have your reservoir. The reservoir is for growth and multiplication of the microorganism. So wherever it goes, this is where it grows and it multiplies. It's the natural habitat of the organism. So it would a human, an animal, food, any kind of organic matter on innate surfaces, water, soil, insects, they can all be reservoirs. Then you have the portal of exit, which is simply that, the port of escape for the microorganism from the reservoir. You have the means of transmission, which is how the transmitted organism gets from its reservoir by various means or routes. You have the portal of entry, the point at which the organism enters a new host, and then you have a susceptible host, which is simply the degree of resistance that the potential host has to the pathogen. So this is your infection cycle. So some of the more prevalent agents that cause infection, like I said earlier, they can be bacteria. This shows you right here how this infectious cycle starts, okay? It's demonstrated as a chain. You have your infectious agent, and then you have your reservoir right there, and then your portal of exit, your modes of transmission, your portals of entry, your susceptible host, and then it starts off again with the infectious agent. So in between all those little circles, you see a pair of scissors. Those areas indicate where we can break that chain of infection, okay? So hand hygiene, sterilization, administering antibiotics, that breaks the chain. Implementing, and we'll learn more about this as we go on, implementing transmission-based precautions, sterilization, use of disposable supplies, hand hygiene, wearing gloves and masks. All these things are ways that we can disrupt the infection cycle, which is what we want to do to stop the spread of infection and to prevent infection. All right, so we have infectious agents. So some of the more prevalent agents that cause infection are your bacteria, your viruses, and your fungi. Bacteria is the most significant and most commonly observed infection causing agent in all healthcare institutions. Viruses, they're the smallest of all microorganisms. They're visible only with an electron microscope, and they cause many infections, including the common cold, hepatitis B and C, and acquired immune syndrome, which is AIDS. And antibiotics have no effect on viruses. They are, there are some antiviral medications that are available that are effective for some viral infections. So like the flu can be a virus, and they have medicines that you can take for that. And then we have fungi, which are plant-like organisms. So your molds and your yeasts, and they're present. You can find them in air, soil, and water. So viruses. A virus, like I said previously, is the smallest of all the microorganisms, and it's visible only with an electron microscope. Viruses can cause many infections, the common cold, hepatitis B and C, the flu, and acquired immunodeficiency syndrome, which is known as AIDS. Antibiotics have no effect on viruses. You're going to need to know that. That might be a question on your test. So antibiotics are not helpful or effective when given against a virus. They will not work. But like I said, there are some antiviral medications available that are effective. All right, so fungi. Fungi are plant-like organisms, molds and yeast that can cause infection. They're in the air, soil, and in the water. Some examples of infection caused by fungi include athlete's feet, ringworm, and yeast infections. And these infections are treated with antifungal medications. However, Many infections due to fungi are resistant to treatment. Not all of them, but some of them are. So now we have our classification of bacteria. So bacteria is the most significant and most commonly observed infection causing agent in the healthcare institutions, and we categorize them in various ways. They're categorized by shape. So you have spherical, or we say cocci, or we have rod-shaped bacilli, or corkscrew-shaped, which are spirochetes. So bacteria can be categorized also as either gram-positive or gram-negative based on their reaction to the gram stain. So you guys, this is taking you back to microbiology when you were doing growing bacteria and staining it to try and figure out what they were. You guys might not remember that. So just as a little refresher, for example, if you have a gram-positive bacteria, they have very thick cell walls that are resistant to decolorization, which is their loss of color, and they are stained violet. However, your gram-negative bacteria, they have chemically more complex cell walls, and they can be decolonized by alcohol, which means that the gram-negative bacteria do not stain. So this information is crucial because doctors need to know this information when they prescribe the appropriate antibiotic therapy. Antibiotics are classified as specifically effective against only gram-positive organisms or as broad spectrum, and they're effective against several groups of microorganisms. Another distinguishing characteristic or a way to categorize your bacteria is their need for oxygen. So most bacteria require oxygen to live and grow, and therefore we call them aerobic. And those that can live without oxygen are called anaerobic. All right, so what are the factors affecting an organism's potential to produce disease? So not all organisms to which a person is exposed to actually cause the disease. An organism's potential to produce disease in people depend on a variety of factors, including what's the number of the organisms? What's the virulence of the organism or its ability to cause disease? What is the competence of the person's immune system? Are they immunocompromised? Do they have AIDS? Do they have cancer? They've been getting chemotherapy and their immune system is very compromised. And then the length and intimacy, which is also another word for extent, of the contact between the person and the microorganism. So possible reservoirs for microorganisms. So the reservoir for growth and multiplication of microorganisms is the natural habitat of the organism. Possible reservoirs that support organisms pathogenic to humans include other people. Other people can be carriers, although asymptomatic, which we've learned a lot about that with COVID. There are people who have absolutely no symptoms, but they're positive, and then there's people who are just carriers of the disease. So they transmit the disease but don't have any symptoms. You have your animals, so your mosquitoes that deliver West Nile virus and the Zika virus. So the West Nile virus is a perfect example of a pathogen whose reservoir is usually an animal, but most frequently birds. So mosquitoes feed on infected birds, they become infected, and they pass the infection on to people when feeding on their blood. And you have soil, you can find gas gangrene and tetanus. You have your food, water, and milk. So undercooked ground beef and fresh leafy vegetables can carry E. coli, which can cause infections. Milk can contain listeria unless it's been pasteurized. And then you have water, which can also harbor Giardia E. coli and Shigella. So drinking or swimming in contaminated water can begin the infectious cycle in people. And then we have inanimate objects. So inanimate objects can also harbor organisms such as the flu, which may be spread if a person touches a contaminated article and then touches your eyes or your nose. So nurses need to pay special attention to transferring organisms. For example, nurses with artificial nails, which is a huge no-no in all the facilities and hospitals, can harbor large numbers and different varieties of microbes under the nails. So ineffective hand washing, improper glove use may all result in exposing an immunocompromised patient to the risk of infection. So we have to be extremely careful. Oops. All right, so infection prevention. So how can we prevent infection? Hand washing. Hand washing, hand washing, hand washing, hand washing. I cannot stress that enough. So much can be prevented with just washing our hands. So hand washing is important. It's a part of medical asepsis. So medical asepsis is the measures that we use to reduce and prevent the spread of pathogens. And we use it in all healthcare settings. Then we have surgical asepsis, which is the state of being free of all microorganisms, not just pathogens. So we call this the sterile technique. And we'll talk a little bit more about that later. So common portals of exit. So the portal of exit is the point of escape for the organism from the actual reservoir. The organism cannot extend its influence unless it moves away from the original reservoir. So each type of microorganism has a typical primary exit route. So in the respiratory tract, it's going to be coughing, sneezing, which results in droplet and airborne precautions, and some infections that are spread that way are Mycobacterium tuberculosis and Streptococcus. We have the gastrointestinal tract. Okay, so it can be common portals of exit are feces and saliva, and that can spread Salmonella enteritis and Salmonella typhi, and also hepatitis A. Then we have the genitourinary, which is your urine and your vaginal secretions. So that can also you can have your E. coli, your hepatitis A, your herpes simplex virus, and varicella. Then you have your skin and your mucous membranes. So that again could be herpes simplex and varicella. And then you have your body, blood/body fluids. So biting arthropods, which are bugs that bite you, like spiders, fire ants, lice, fleas, bees, and bed bugs, and they can spread HIV and hepatitis B and C. All right, so means of transportation. An organism can be transmitted from its reservoir by various means of routes. So some organisms can be transmitted by more than one route, and organisms can enter the body by way of contact transmission, either directly or indirectly. So direct contact requires close proximity between the susceptible host and an infected person or a carrier. And it includes activities such as touching, kissing, and sexual intercourse. Healthcare workers have the potential to directly transmit organisms to susceptible people throughout touching. And then we have indirect contact, which involves personal contact with either a vector, which is a live creature that transmits an infectious agent to a human, usually an insect, or an inanimate object called a formite, such as equipment or countertops. Organisms can also be spread through airborne route, which is when an infected host coughs, sneezes, or talks, and when the organism becomes attached to dust particles. And then another means of transmission is through droplets. So droplet transmission is similar to airborne. However, the airborne particles are usually less than 5 millicentimeters, and droplet particles are greater than 5. On table 24-1, it summarizes the means of the transmission for several organisms, their reservoirs, and the examples of the type of diseases that they transmit. So you might want to take a look at that chart. Very helpful. So we have the portals of entry in the susceptible host, another means of transmission. So the portal of entry is the point at which organisms enter a new host. The organism at this time has to find a portal of entry to a host, or it might die. The entry route into the new host is often the same as the exit route from the prior reservoir. So the skin, urinary, respiratory, and gastrointestinal tracts are pretty much your common portals of entry. So microorganisms only survive in a source that provides shelter and nourishment. And if the microorganisms overcome any resistance mounted by the host's defense. Susceptibility is the degree of resistance that the potential host has to the pathogen. So hospital patients are often in a weakened state of health because of the illnesses, and they have less resistance. that makes them more susceptible to infection. So many factors influence a host's susceptibility. So patients taking meds, maybe that alter their immune response. So patients that have AIDS or HIV or cancer patients, they are a little bit more, they are definitely more susceptible than some other people. Okay, so what is our elderly risk of infection? Let's see. Sorry, guys, my things aren't lining up here. All right, so some elderly people have weakened immune systems due to aging or chronic illnesses even, so that automatically puts them at a higher risk for infection. So malnutrition is a big factor for older people. They have poor nutrition due to improper diet. So as they get older, their diet changes. You know, they could be malnutrition for a number of reasons. Maybe they have trouble getting to the kitchen because they have trouble walking, so they don't cook for themselves. Maybe they just don't have an appetite. They're having like a failure to thrive situation and they're not hungry. Maybe they don't have money for food. I mean, there's a bunch of different things that can cause the elderly population to become malnutrition. And then dehydration, which is a serious condition resulting from inadequate fluid in the body. So a lot of older people, as they get older, they lose that drive to tell them to drink. So a lot of your older population do become dehydrated, which makes them more at a risk for developing an infection. So these conditions can result from, like I said, I already named some examples, but also maybe if they have difficulty chewing, if they can't afford dentures, or they have some loose teeth, or some teeth that hurt, or maybe they've had a stroke and they have impaired swallowing, or they have a lack of appetite. Maybe they even take medications that change their appetite. There's a variety of things that can cause that. So the following factors also put the elderly population at a higher risk for infection than just the general population like you and I. So they have weakened immune systems, decreased circulation, definitely slower wound healing, malnutrition, dehydration, we talked about that. They have limited mobility. Hospitalizations can increase their risk. Difficulty swallowing, incontinence, feeding tubes, and then urine catheters. So urine catheters are huge. So you'll learn once you throughout this course and then being in the hospital that when we use catheters in people, they're usually a last resort. Okay, and then there's always usually a nurse-driven protocol in place that if you don't think that the patient needs the catheter, that within a day you start looking at them and assessing them to see if you can remove it, because the longer they have it, the higher their risk is for them developing an infection. And if a patient if a patient gets a urinary tract infection while in the hospital, the Medicaid and Medicare do not pay for those infections. So that's why the hospitals are so big on preventing these infections. So this slide here just shows you again how to break the, how can we break the chain of infection? So in the middle you have the pathogen, okay? Then you can come over here and give it antibiotics. And then you can make sure you're covering your wounds, cleaning them and covering them and protecting them. And then right here, big thing, hand washing, more hand washing, using gloves where you're supposed to, changing them as needed. And then vaccines and being safe when you are giving injections. Okay, so breaking the chain of infection. So we need to break the chain of infection to help prevent the infection, okay? So taking the right antibiotics, like we just said, quickly turns a person's body into an unfriendly reservoir, so that way the infection can't grow. You're gonna cover those wounds, okay? You're gonna wash the hands, wear gloves, all that good stuff that we just talked about. Again, here, it's just another good slide for you guys to look at. It just talks about the infectious agent, the host, and different ways that you can break that chain of infection again. You guys should review that on your own. So preventing infection. So there are state and federal government agencies that have put into place important guidelines and even laws concerning infection prevention. So you have the Occupational Safety and Health Administration, also known as OSHA. which is a federal government agency that makes rules to protect workers from hazards on the job. Then you have the Centers for Disease Control and Prevention, the CDC, which we said earlier is a government agency that issues information to protect the health of individuals and communities. So in 1996, the CDC recommended a new infection prevention system that was implemented to reduce the risk of contracting infectious diseases and in healthcare settings. And they implemented what we called standard precautions and transmission-based precautions. So we're going to be talking more about those. So standard precautions. So as nurses, it's imperative that we understand the various precautions or barrier techniques if we have to use them, and correctly how to use them so that we can minimize infection risk to patients as well as to ourselves too. We don't want to get any infections. So first and foremost, you always use standard precautions with every single patient. Every single patient, you are going to implement standard precautions, okay? So standard precautions are used in the care of all hospitalized patients, regardless of their diagnosis or possible infection status. So if they came in with, they just sliced their finger, and we're just, going to give them some IV antibiotics, so they have to spend the night. We're going to implement standard precautions with them. So standard precautions is a method of infection prevention in which all blood, body fluids, non-intact skin, and mucous membranes are treated as if they were infected with an infectious disease. You have to assume that everybody has an infectious disease because you don't know what's going on with people. People are not always honest with you, so you always have to protect yourself and others and implement these precautions. So we're going to wear gloves. So gloves are worn if the possibility exists that your hands could come in contact with blood or other body fluids. Gloves are also worn when touching any surface that could be contaminated with pathogens. And then you can wear a waterproof gown, and we wear this if the possibility exists that your clothes could become soiled with blood or other body fluids. And then you can wear a mask, a face shield, and eye goggles, and you wear them if the possibility exists that blood or other body fluids could splash or spray. So right now, nursing people are wearing N95 masks, a face shield, and gowns and gloves when they go in any room for a COVID patient. Okay, so that is what they wear. They wear every single thing that I just told you every time they go into a room to take care of a COVID patient. So, all right. So other ways that we can prevent, that we can implement standard precautions to prevent infection is we want to be careful and mindful when we're using sharps, such as needles and razors. We want to make sure that we are disposing of them properly in OSHA-approved containers. We want to make sure that when we're using them and administering injections, that we're being safe and wearing gloves and administrating them correctly and in the proper way. Broken glass, we never really want to handle that. We want to make sure that it's swept or vacuumed for disposal. Spills with blood and other bodily fluids must be cleaned up promptly with an approved cleaning agent. Personal protective equipment must be worn when cleaning up spills. So your PPE, so PPE is what everybody calls it. It is personal protective equipment, but nobody really wants to say that because it's a mouthful. So we always just say PPE. And then hands must be washed when you remove your gloves. So hand washing is the single most important method of the spread of infection. So you notice how many times I said that, right? It's extremely important. Hand washing, hand washing, hand washing. So here is a slide that just shows you, hold on, it's not coming over, there you go, that tells you about standard precautions. You can read that, it is in your book, it's in box 8-1. So body fluids, so what are body fluids? So body fluids are liquid or semi-liquid substances that are produced by the body. That includes blood, urine, feces, vomit, saliva, drainage from a wound, sweat, tears, semen, vaginal secretions, cerebrospinal and amniotic fluid, and even breast milk. So when it comes to hand hygiene and hand washing, so in the healthcare setting, hand washing takes on a special importance because of the chance of picking up a pathogen, and passing it on to someone else is greater than normal in any day life because of all the pathogens that are in the hospital. So although the specifics of how hand washing is performed can vary from setting to setting, one facility might say do it for 30 seconds, one might say do it for 60 seconds. Even though they vary, there's one aspect of hand washing that always, always remains the same, and that's that you perform it thoroughly, properly, and consistently. If you go and you look at skill 20 in box 24-1, performing hand hygiene using soap and water, it shows you exactly how to scrub your hands and your nails and how long it should last. And then we're going to be able to do this in lab too. We're going to go over hand hygiene and how to do it. So at a minimum, you wash your hands when you first arrive at your facility. You wash them before you enter a patient's room or a clean supply room, before you obtain clean linen from a linen cart, before handling a patient or a resident's meal tray, before you go on break and before you leave your shift, before and after drinking, eating, or smoking, before and after inserting contact lenses, using the bathroom, after coughing, sneezing, or blowing your nose, after touching anything that may be considered dirty, after picking up an object from the floor, after removing disposal gloves, including those times when you're replacing a torn glove, and then after handling your hair or applying makeup or lip gloss. So the other day I actually was at Giant and I was getting some lunch meat from the counter, and this wasn't a healthcare story, but the same principle. There was a lady who was running around, and before I gave her my order, but she was running around cleaning up these 2 slicers that had different meat on it. And she had her gloves on. So she finished cleaning them up. She went and got my ham. She put it on the slicer, and then she took her hand and scratched her forehead with the gloves on. And then she put her hand back down to slice the ham. And I had to say, excuse me, do you mind changing your gloves before you slice my hand? And she was a little bit upset that I asked her to do that. And she kind of had a little bit of an attitude with me. And she says, well, all I did is just clean these machines where the meat was. That's all it was. And I said, well, no, actually, you have those gloves on and you touched your forehead. So I don't know what's on her forehead. She's been running around all day. Maybe she's coughing and she's sneezing. So that would have been the perfect opportunity if she had something on her gloves. She puts it on her meat and then brings it home to me, and then I eat it. And there you have it. That's how infections start. So you have to be very mindful. And I don't think she did it on purpose. You just don't think, because we're not really used to wearing gloves and masks all the time. And it is easy to forget. But when you're dealing with people in the healthcare setting, patients, and when you're dealing in, food industries, you do have to be specifically very mindful. All right, so stages of infection. So a couple stages of infection. We have the incubation period. Okay, the incubation period is the interval between the pathogen's invasion of the body and when the symptoms of infection actually start, when the patient starts to see the signs of infection. So during this stage, the organisms are growing and they're multiplying. The length of incubation may vary. For each different infection, you have a different incubation time. So for example, the common cold usually has an incubation period of 1 to 2 days. So I was at a party over the weekend. Somebody there had a cold. They sneezed over top the forks. I went to get something to eat, touched the forks, rubbed my eye later. 2 days later, I have a cold now. That was the incubation period. I was subjected to it. It took 2 days for it to manifest. And now on day 2, I am sneezing and coughing and having a runny nose and facial pressure from like sinus pain and stuff like that. So then you have like tetanus, which has an incubation period ranging anywhere from 2 to 21 days. So every organism has a different incubation period. So then you have the prodromal stage, which is this is the period where a person is most infectious during the prodromal stage. So early signs and symptoms of disease are present, but they're often vague and nonspecific. They range from fatigue and malaise to just a low-grade fever. This period typically lasts hours to several days, and during this phase, the patient is often unaware of even being contagious. So as a result, the infection continues to spread to other hosts. So now we have the third stage, which is the full stage of infection. So the presence of the infection, specific signs and symptoms indicate the full stage of illness. So the type of infection determines the length of the illness and the severity of the manifestations. So symptoms that are limited or occur in only one body area are referred to as localized symptoms, whereas symptoms manifested throughout the entire body, we call those systemic symptoms. And lastly, we have the convalescent period. This period involves the recovery from the infection. So the convalescent may vary according to the severity of the infection and the patient's general condition. The signs and symptoms start to disappear and the patient starts to return to a healthy state. However, depending on the type of infection, there could be a temporary or even a permanent change in the patient's previous health state, even after the convalescent period is over. So a good thing to know is that some people may actually continually pass through the 4 phases with the same infectious process, like with herpes simplex. So you get that, it never really goes away. It continues to go through this. You have outbreaks, and then you're contagious, and then you have your convalescent period. So although there may only have been one infectious exposure, the infection may continue to cycle throughout the phases. So let's talk about COVID for a second. So everyone knows that what they think they know is that the incubation period is anywhere from 1 to 12 days. Some people get it on day 2, some people get it on by 12. 97% of people get it by the 12th day is what I read. And it could even go up to day 14. So then you have that stage in the beginning where you have it, but you have no symptoms. So that could be your incubation and your prodromal stage. Then you have your stage where you have full stage illness, you have all the signs and symptoms, you're really sick, and then that convalescent period. And then we talked about during that convalescent period, the symptoms start to disappear and you start to return to a healthy state. But depending on that infection, there could be a temporary or permanent change to your health. So with COVID, what we're seeing is that it causes significant damage to the lungs, and it causes fibrous tissue to grow there. So these patients, it's taking them upwards of 3 months before they feel like themselves again, because some of them are so sick and they're so weak and fatigued that they just aren't bouncing right back. So that convalescent period is really different we're seeing with these COVID patients. All right, so factors affecting the host susceptibility. So the susceptibility of the host depends on a number of factors. So the integrity of skin and mucous membranes, which protects the body against microbial invasion. So do you have open wounds that you don't have Band-Aids on and things like that you're not taking care of? So if the skin is open, it's an easy way for an organism to get in there and cause an infection. Then we have the pH levels of the GI system, so the gastrointestinal and the genitourinary tracts, as well as the skin, which help to ward off microbial invasion. Then you have the integrity and number of the body's white blood cell counts, which provides resistance to certain pathogens. So with regards to white blood cell counts, so patients that have cancer that go through chemotherapy, one of the side effects from chemotherapy is that it cannot discriminate between just the cancer cells and the good cells. So it kills everything in the body, even the white blood cells, which we know we need to fight off infection. So these people, they're a good example of why they would be more susceptible, because the integrity of their white blood cells is not very good. They hardly have any. So they are at a big risk for developing an infection. Then we have the age, sex, and race and heredity, which influence susceptibility. So neonates and older adults appear to be more vulnerable to infection, okay? Immunization, either if you incurred them, if you acquired them through a vaccine or naturally, which act to resist infection. Then your level of fatigue, your nutritional and your general health status, the presence of pre-existing illnesses, previous or current treatments, and certain medications all play a crucial part in susceptibility of a potential host. And then stress level, being stressed and not taking care of yourself with proper nutrition, that can have an adverse effect on your body and leave you susceptible to developing infection. And then the use of invasive or indwelling medical devices, which provide exposure to and entry for more potential sources of disease-producing organisms, particularly in patients whose defenses are already weakened by disease. So a good example of that would be a catheter can introduce signs of infection. Signs of susceptibility and cause infection. All right, so outcome identification and planning infection control. So as nurses, we are responsible for developing appropriate patient outcomes. After we review the assessment data, consider the cycle of events that resulted in their infection, and incorporate all the principles that we know about infection control. So nursing intervention should always be focused on controlling or preventing infection, and it can have a positive impact on their patient outcomes. So some examples of expected patient outcomes are appropriate for preventing infection and using infection control techniques would be that the patient will be able to demonstrate effective hand hygiene and good personal hand hygiene practices. They will be able to identify signs of an infection. So if they understand what to look for signs of infection, hopefully they can prevent it or catch it early and seek medical treatment. Maintain adequate nutritional intake. So make sure that you're eating a lot of foods high in protein that help repair the body so that the body can take care of itself and fight off infection. We want them to be able to demonstrate proper disposal of soiled articles. We want them to use appropriate cleansing and disinfecting techniques. So when they're bathing and when they're wiping in their genital area, we want to make sure that, a good example would be making sure that they wipe from front to back for women and not back to front. And then demonstrated an awareness of the necessity of proper immunization. So are you getting your flu shot each year? Are you over 65 years old? You need your shingles vaccine so you don't get shingles, and you need your pneumonia vaccine so you don't get pneumonia. And then lastly, demonstrate stress reduction techniques. So if your patient has a high stress job, talk to them and find out ways that they can incorporate stress-free activities into their life, even if it's just a couple minutes a day to help keep their body from not being stressed. So here we have the cardinal signs of an acute infection. So the inflammatory response is a productive mechanism that occurs in the body that helps to eliminate the invading pathogen and allows for tissue repair to occur. And inflammation is what helps the body to neutralize, control, or eliminate the offending agent and to prepare the site for repair. So the hallmark signs of acute infection are redness to the area, heat, it would feel warm to touch. It can feel warm or it can feel extremely hot. You may notice swelling. The patient may have pain or loss of function wherever the infection is. So there's also laboratory data that we look at that correlates to an infection. So elevated white blood cell count. If their white blood cell count is elevated, that can be a sign of an infection. The normal range that you want your white blood cell count to be is between 5,000 and 10,000. So like I said, with the patient that has chemo, sometimes they don't even have any white blood cell counts. I was an oncology nurse for many years, and I saw them where they were what we call neutropenic. So they didn't have any white blood cell counts at all. So they didn't have anything to help them fight off infection. And then, I see patients with pneumonia and things like that, and their levels can be like 15 or 20,000, just depending on how sick they are. So then we will also see an increase in specific types of white blood cells. On a differential, there's a lot of them, neutrophils, eosinophils, all that. Then we have elevated erythrocyte sedimation rate. So usually when you see that, that's an indicator of inflammation, which can be an indicator of infection. And if that was elevated, it would be over 20 an hour. Then we have the presence of microorganisms on a culture of a specific area. So it could be fluid. We could have sent out a urine sample. Maybe we sent out blood cultures. Maybe the patient has pneumonia and they gave us a sputum sample, or if we drained anything and we sent out cultures. So you can also refer to box 24-1, which talks about the laboratory data and If you go to page 602, we'll talk about that. That's the page that it's on. All right, so bacterial flora. So there's two types of bacterial flora that are normally found on our hands. We have transient bacteria and resident bacteria. Transient bacteria are attached very loosely on the skin, and although they're usually easily removed by thorough hand washing, they do have the potential to adjust to the environment of the skin where they're present in large numbers, and over a long period of time, they can turn into resident bacteria. And these are found in the greatest number under the fingernail. So if you go back and look at that paper that I showed you, or that in your book where it has about how proper hygiene, how to wash your hands and get under your nails and clean your thumbs real good. That's exactly why you want to clean like that, because there's so many germs underneath your fingernails. And then we have resident bacteria, which is found in creases in skin, and it requires actual friction with like a brush to remove. They're not as easily removed. So now we have 4 categories that are responsible for the majority of hospital-acquired infections. So hospital-acquired infections are infections that actually take place in the hospital, okay? So for whatever reason, and sometimes despite our best efforts as healthcare providers, certain patients in the hospital develop these healthcare-associated infections. They used to be called nosocomial infections. You'll see that used interchangeably, especially throughout these slides. I do use both of them, but they are the same. Nosocomial infections and hospital-acquired infections. So the prevention of hospital-acquired infections is a major challenge for healthcare providers. And in the United States, hospital-acquired infections account for tens of thousands of deaths, tens of thousands. And it costs upwards of 28 to 33 billion of additional healthcare costs annually, okay? And as of 2013, the Centers for Medicare and Medicaid Services, we call that the CMS, they no longer reimburse hospitals for preventable hospital-acquired conditions, okay? So some of them are urinary tract infections, surgical site infections, bloodstream infections, and pneumonia. So how can patients get these? I want to just give you examples of how they can get these infections. So patients can come in for maybe a knee replacement, okay? He comes in for a knee replacement, he stays in the hospital 2 days, but he has a lot of pain, okay? So he doesn't really want to get up and walk too much, or he just wants to lay around in bed, and he stays in bed most of the time when he's not working with PT. So he developed pneumonia because he's laying in bed, he's not taking deep breaths. That would not be covered by CMS if that patient got pneumonia in the hospital because they came in to have a knee replacement. Then we have bloodstream infections. So if you think of the patient that has cancer, a lot of those patients have what we call a port or a central line that's placed in their chest. And we put that there. Usually they get a port because they have to have so much access. We're always drawing labs and we're giving chemotherapy. So it has to go through a very strong vein. So we put it up there and it goes right into the heart, the line where you put it. It goes through the chest and it ends up in the bottom of the heart there. So when we're giving medications and we're checking the line to make sure that it's still good and make sure that it has blood return, if we don't use the proper techniques and we don't wash our hands and keep everything medically aseptic when we're doing it, then they can get an infection in their blood, okay? So if they come in just to get chemo and the nurse taking care of her doesn't implement the right precautions and she gets a bloodstream infection, CMS is not going to pay for that, okay? Same thing with surgical site infections. Coming in for that knee replacement, they go home and they have an infection, a couple days later, CMS is not going to that's not going to cover it if they got that infection while they were in the hospital. All right, so these are risk factors for what we call VRE. That's how you hear it in the hospital. If your nurse is giving you reports, she'll say, Mrs. Jones is here for a knee replacement. She has a history of blah, 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 and VRE. That's what they call it. They don't say vancomycin-resistant enterococcus because that's a mouthful. So vancomycin-resistant enterococci, VRE, is a very serious pathogen that we find in hospitals. So they are found in normal intestinal and genitourinary tracts, and they cause hospital-acquired infections with a very high mortality rate if the organism becomes vancomycin resistant. So these organisms are resistant to an antibiotic by the name of vancomycin, okay? So that's why we call it vancomycin resistant enterococci. That enterococci is resistant to vancomycin and that can't kill the infection if we treat it, okay? So VRE is usually spread by coming in contact with feces, urine, blood of an infected or a colonized person. So healthcare workers have to be especially careful to ensure that we are recognizing it, diagnosing it, isolating it, managing it, and maintaining infection control. So risk factors for developing VRE are if they have a compromised immune system, if they have a presence of a urinary or a central IV catheter, if they are getting prolonged antibiotic use, especially with vancomycin, if they've had recent abdominal or chest surgery, and then if they have lengthy stay in the hospital, especially in the ICU, they can develop this. All right, so now we have C. diff. I don't know if you guys have ever heard of C. diff before. You will hear about it a lot, especially when you start getting into clinicals and then when you start working. So C. diff, when we give patients antibiotics, okay, particularly broad spectrum antibiotics, when they're prescribed or they take them for a long period of time, what happens is that helpful bacteria also wind up getting destroyed. And then this C. difficile bacterial can grow out of control and it can create like a bacterial imbalance. This bacterial imbalance causes watery diarrhea, maybe some fevers, and some mild abdominal cramping are seen. And those are the most common signs of symptoms. But this is extremely, extremely easy for other patients to get, okay? So you can spread this very, very quickly. So these patients have to be on special precautions when they're in the hospital. You have to wear gowns and gloves when you go in, and you always have to wash your hands, but not with antibacterial soap, only soap and water. So how can we prevent it? Well, the CDC has made some recommendations that are useful to help prevent the occurrence and spread of C. diff. So they say only prescribe antibiotics cautiously. So you don't want to give them to everybody if you don't think they need them. You want to use contact precautions for patients who are confirmed or suspected of having C. diff. So sometimes your patients they're in the hospital and automatically they start having this terrible, awful diarrhea. Well, it can take sometimes, it's gotten better, but it can take sometimes 24 hours when you send that sample out, before you find out if they actually have it. So you want to take precautions for yourself, the patient, and other people around them. So we will always put them on contact precautions until the test comes back. Okay, we use the precautions. If we think they have it, we give them a private room. Okay, we're going to use gown and gloves before we enter the room and during patient care activities. We're going to use effective hand hygiene. So alcohol-based hand rub. So when you're washing your hands in and out of the room there with those little antibacterial soap things on the wall, that's not effective. Soap and water is considered more effective at removing those C. difficile spores. You want to have a room and a non-disposable equipment cleaned with bleach or other appropriate disinfectants. So when those patients are no longer in that room, special people from EVS, Environmental Services, has to come down and they have to clean that room differently. They would clean regular rooms. And then when they transfer out of the facility, if they're going to long-term or short-term rehab, something like that, you want to notify the facility that they had C. diff, because a lot of pending admissions, they won't take people with C. diff, or they have to have certain accommodations. So they do need to know that. So what measures can we take to reduce the incidence of healthcare-associated infections or nosocomial infections? So we can have constant surveillance by infection control committees. okay, a nurse epidemiologist. So every hospital has an infection control team. That's what their job is. They monitor the hospital for infections, how to prevent them, what can we do, what can we improve. They know the latest and greatest evidence-based evidence, the latest and greatest evidence-based interventions to keep us from spreading infection. And then as a nurse on a unit, you will probably have to join a committee, like I said in one of my other slides, and you can join infection control or something like that and figure out what you can do to spread infection, and then you bring that to prevent the spread of infection, and then you'll bring that information back to your coworkers on your floor, and then you update them every time you go to a meeting, and then you put those actions into place. So we can have written infection prevention practices for all agency personnel, and your infection control team is responsible for that. They can make hand hygiene recommendations. They will also have hand hygiene secret shoppers. So people come through with clipboards. You don't even know who they are. Sometimes they don't have clipboards. They look like they're visitors and they're in regular clothes, and they are looking to see if you are doing hand hygiene before and after you go into those rooms, after you take off your gowns, and then they report back to the infectious team committee, and then each unit gets like a percentage of how well they did with their hand hygiene. And you always want to have it above 90%. We can, let's see, we can have infection control precaution techniques, and then we want to keep the patient in the best possible physical condition so that they do not get a hospital-acquired infection. So this is just a good little slide here. It tells you about the body's defense against infection. How does the body fight off? We have, the body has its own normal flora, okay? So you have your saliva, which in your saliva, there's antibacterial enzymes which fight off infection. You have your tears, which also have antibacterial enzymes. You have your skin, right? And if it's intact, it prevents entry. You have your stomach acid, which has a low pH, which kills harmful microbes. You have your mucus linings, which trap dirt and microbes from getting into your lungs. And then you have your good gut bacteria, right, to keep out the bad bacteria. So we have your inflammatory response. So the inflammatory response is a protective mechanism that eliminates the invading pathogen and allows for tissue repair to happen. So inflammation helps the body to neutralize, control, and eliminate the offending agent and to prepare the site for repair. Then you have your immune response, which is the normal immune response, which involves the collective response of your immune system to an invading organism. So the complex mechanisms that constitute the immune response occur as the body attempts to protect and defend itself. The foreign material in the body, the infection, we call an antigen, and the body commonly responds to the antigen by producing an antibody. So in, let's just say with pneumonia. So pneumonia comes in, we're going to call that the antigen. The body recognizes it and quickly produces antibodies to fight that off. And then some of those little antibodies will stay there, and it will recognize it for when it sees it again and hopefully fight it off. All right, so there are factors that determine the use of sterilization and what type of disinfection methods we use. The first one is the nature of the organisms that are present. So the CDC recommends that all supplies, linens, and equipment in every healthcare setting should be treated as if the patient were infectious. So some organisms are easily destroyed, whereas others can withstand certain common sterilization and disinfection methods. So if you have, if you take some sheets and a pillowcase and a gown into your patient's room, and then they say, oh, I'm not going to get changed today because I'm leaving in an hour, I'm getting discharged. When you are done with those linens, you would not want to put them back into the pile to use for your next patient. You want to put them in the dirty linen. Assume that your patient had an infection, no matter why they were there, and you would want to have them cleaned again. Same thing with any, body washes or anything like that that you bring in the room, you would want to just throw them out. So the next factor is the number of organisms that are present. So the more organisms present on an item, the longer it's going to take to destroy them. Then we have the type of equipment. So equipment with small lumens, crevices, or joints, they require special care. Certain articles that may be damaged by various sterilization and disinfection methods require special handling. your intended use of equipment. So the need for medical or surgical asepsis influences the preparation and cleaning of equipment. In the home, it may be safer to use equipment and supplies that are clean, but most healthcare facilities use sterilized articles for patient care to help keep them safer. And then we have the available means for sterilization and disinfection. So the choice of chemical or physical means of sterilization and disinfection completely depends on the nature and the number of the organisms, the type and the intended use of the equipment, and the availability and practicality of the means. If you go to table 24-3, there is a list of methods for sterilization and disinfection. You guys can take a look at that to get some more examples. And then the last factor is time. So time is a key factor when sterilizing or disinfecting articles, and failure to follow the recommended time periods is very negligent and will cause the spread of infections. So here we're going to talk about common nosocomial infections. We already told you that that is interchangeable with hospital-acquired infections, okay? So common ones that we see in the hospital are genitourinary infections. So those are your kidney infections, your UTIs, okay, urinary tract infections. Then you have bacteremias. Bacteremias are bloodstream infections, so it's an infection that actually gets into the bloodstream. Then you have your surgical site infections, your respiratory infections, and your gastrointestinal infections. So your surgical site infection, that would be the patient that had a knee replacement and they got an infection where they had their surgery incision. Then your respiratory infection, that could be your pneumonia that you develop. And then the gastrointestinal infections, an example of that would be the C. diff. All right, so isolation precaution guidelines, the CDC. We talk a lot about the CDC, the Centers for Disease Control and Prevention, and the Hospital Infection Control Practice Advisory Committee. They have determined 2 tiers of precautions that you want to take when providing care for your patients. So one is transmission standard precautions, which we talked about a little bit earlier. We're using those for every client that we come in contact with. Then we have your transmission-based precautions. So we're going to use with clients with specific infections or diagnoses. If you go to box 24-4, on page 615, the CDC guidelines for isolation precautions in healthcare settings. That's a nice little chart there that gives you some more information on that. So here we have our PPE, right? Personal protective equipment and supplies. So according to OSHA, back in 1992, they determined that healthcare facilities must provide employees with the equipment and supplies that are necessary to minimize or prevent exposure to infectious material. The PPE includes gloves, gowns, masks, and protective gear. So gloves are not a substitute for good hand hygiene. People often assume, oh, I have gloves on, I'm covered. No, you're not. They're worn only once and discarded appropriately according to the facility policy where you work. Then your hands are thoroughly decontaminated and meticulously cleaned, okay, good hand hygiene. And when nursing activities that don't involve the possibility of soiling the hands with either body fluids, anything like that, gloves are not necessary. So activities such as turning a patient, feeding a patient, taking vital signs, changing your IV fluids, administering medications, they don't require the use of glove as long as the potential contact with body fluids is not present. If there is a possibility of soiling the hands with body fluids, then you must wear your gloves. Then we have gowns. Gowns are usually worn to prevent soiling of the healthcare worker's clothing by the patient's blood and body fluids. The protective barrier, they're donned immediately before entering the patient's room. Individual gown technique is recommended. Usually they show you how to put them on. Your hospital will give you a training on that. This involves wearing a gown only one time and then discarding it appropriately according to your policy. So our policy at our hospital is you only wear it once, and when you take it off in the patient's room. And I see a lot of doctors, not just doctors, but other people too, they walk out of that room with that gown on and they put it in the trash can outside. So when you do that, what do you think is happening? you are bringing that infection that's on that gown outside of the room where other people are walking, other patients are going past for tests and things like that. So it's at risk for causing an infection. So our hospital says you need to take it off in the room. So that's what we do. If a gown becomes heavily soiled while you're providing care or moistened with blood or body fluids when you're caring for a patient, you should remove it, perform thorough hand hygiene, and put on a clean gown. So myself, I always have an extra gown in the room with me because you never, ever know what's going to happen and if you may need to change one. So we know we're going to wear masks. God, we've heard so much about masks, right, with COVID-19. So masks help prevent the wearer from inhaling large particle aerosols, which usually travel about 3 feet, and then your small particle droplet, which can remain suspended in the air and travel much longer distances. So masks also protect the patient from the respiratory secretions of the healthcare worker. So maybe if you have a cold, you're going to want to wear a mask, although we're all wearing masks now. I'm not sure we're ever going to get back to a stage where we don't wear masks. So that's not something you have to worry about now. You're going to be wearing that mask. Masks discourage the wearer from touching the eyes and nose and mouth, and it limits the contact of organisms with your mucous membrane. So that's how it prevents infection. A mask is typically worn only once and never lowered to the neck and then brought back over the mouth and nose for reuse. So that's really not occurring in the situation with COVID right now because these supplies are limited. So the hospital policy where I work states that you have to use your N95 mask for at least 6 shifts, or if it breaks or becomes soiled, then you can get another one. So for those of you who have never seen, this is an N95 mask right here. This is what you wear when you're taking care of COVID. Previously, if you were taking care of mainly patients that had tuberculosis, or if you thought they had TB, we would wear these. Normally, you're fitted at your facility, okay, to see which one fits you because you want to have the right size so you can keep all those disgusting infectious particles out. So what they do is they bring you in and they put a mask on you and they put this big plastic thing over top of your head, and then they spray this like sugary spray in there, and if you can smell it, then you have the wrong size. So they keep experimenting and go back and forth with the spray and the different size N95 respirators until they spray it, and then you can't smell it anymore, and then you know that you have the right size. And that's usually done by your employer when you get hired. One of the first things they do, actually. Okay. So standard precautions, again, standard precautions are used in the care of all hospitalized patients, regardless of their diagnosis or possible infection. We wear PPE, such as that mask, the eye protection, the face shield, or the fluid repellent gown during procedures and care activities that are likely to generate splashes or sprays of blood or bodily fluid. You use that gown to protect skin and prevent soiling. We have new additions, which are respiratory and hygiene cough etiquettes. So any patient, family members, and visitors with undiagnosed transmissible respiratory infections require education to cover their mouth, okay, and nose with a tissue when coughing and promptly dispose of the tissue. So you might have visitors that come in and they cough without covering their mouth and they sneeze. So it is your job as a nurse to educate them and teach them about proper hygiene. So during periods where there's an increased occurrence of respiratory infections, we want to offer them a surgical mask before coming in to patients that are coughing and have other symptomatic people upon entry to the healthcare facility or office. You can give them a mask to put on. So encourage the coughing patient to maintain more than 3 feet separation from other people is always acceptable. And right now we're talking about 6 feet, right? Stay 6 feet away from each other. We want to use safe injection practices. So we want to use single dose vials when possible that just have the attachable needle and you get rid of it. So you don't have to worry about, reusing it over again. You want to use disposable needles and syringes for each injection. And you want to prevent contamination of injection equipment and medication by using your medically aseptic technique. And wear your face mask if you're placing a catheter or injecting material into the spinal or epidural space. But like I said, right now, we're using that gown and that mask and that face shield for every patient. So Now we have transmission-based precautions. So transmission-based precautions are used in addition to standard-based precautions for patients that we see in hospitals with a suspected infection with a pathogen that can be transmitted by airborne, droplet, or contact routes. So the 2007 guidelines from the CDC include PP. They include that you should don personal protective equipment, that PPE, when entering the room of a patient on contact or droplet precautions. Previously, PPE was only required when the nurse was delivering care within 3 feet of the patient, but that ship has sailed. We don't do that anymore. That is not evidence-based practice. So these categories recognize that a disease may have multiple routes of transmission, so either by the air, by droplet, or by contact. And when I say don personal protective equipment, the word don just means to put on your equipment, okay? Put your equipment on. So you'll hear that interchangeably. Then we have isolation transmission-based precautions. So isolation transmission-based precautions are guidelines that are based on pathogens' method of transmission that we follow to contain the pathogen and limit exposure to others as much as possible. So we use standard precautions are used for everyone, and then isolation precautions are used when a person is known to have a disease that is transmitted a certain way. So your different isolation transmission-based precautions, we have airborne precautions, right? So for airborne precautions, if available, we're going to place a patient in a private room that has a monitored negative air pressure in relation to surrounding areas. So 6 to 12 air changes per hour, and then appropriate discharge of the air outside or monitored filtration if the air is recirculated. And you always want to keep the door closed and the patient in the room. So right now, at our hospital, all of our MICU and SICU rooms were turned into negative air pressure rooms. And we are also turning some other units in the hospital into these negative pressure rooms. You want to wear a respirator when entering the room of a patient with a known or suspected case of tuberculosis or even COVID. So you're going to wear that N95 mask. You are going to wear your face shield, and you're going to wear your gown and your gloves when you go in there. Other things that you would put patient in a negative pressure room would be if they had the measles, varicella, which is chickenpox, or any kind of respiratory protection should be worn unless the patient entering the room is immune to these diseases. When you transport the patient out of the room, it's only going to be when necessary if they have to go for a test or procedure, and you want to make sure they have a surgical mask on the patient before they leave the floor. Then we have droplet precautions. So these precautions you're going to want to use for patients with an infection that is spread by large particle droplets, such as your rubella, your mumps, your group A strep, and your flu. These patients also, just like airborne precautions, you're going to use a private room, but the door may remain open with these patients. You're going to wear your PPE upon entry to the room, okay, for all interactions that may involve contact with the patient and potentially contaminate areas in the patient's environment. You're going to transport the patient out of the room only when necessary, again, for procedures or tests, and they have to have a surgical mask on. And then you want to educate that you keep your visitors 3 to 6 feet away from the infected person. And then lastly, we have contact precautions. So we're going to use these for patients who are infected or colonized by multi-drug resistant organisms, MDRO. Some examples of multi-drug resistant organisms are pink eye, C. diff, lice, and scabies. So you are going to place the patient in a private room if available. You, as the provider, are going to wear PPE whenever you enter the room, okay? You are going to change your gloves after having contact with the infectious material. You're going to remove your PPE before leaving the patient environment, and you're going to wash hands with an antimicrobial or waterless antiseptic agent. Okay, then you're going to limit the movement of the patient out of the room as much as possible, only for important reasons like tests and procedures. And then you're going to avoid sharing patient equipment. So you are going to just want to have a set of vital sign machines that just stay in that room that you use for that patient. Okay, so next we have bloodborne pathogens. So a bloodborne pathogen is a disease-producing microbe that is transmitted through blood and other body fluids. Body fluids are liquid or semi-liquid substances that the body produces, such as blood, urine, feces. You can have vomit, saliva. I think we talked about these already. Drainage from a wound, sweat, tears, semen, vaginal secretions, cerebrospinal and amniotic fluid, and then breast milk. So how do we transmit bloodborne pathogens? So there's many ways that they're transmitted. They can be transmitted by needle sticks, which are puncture wounds caused by a dirty hypodermic needle. You can have cuts from contaminated broken glass, such as a broken blood tube. You can have direct contact between infected blood and broken skin, your mucous membranes, or even the eyes. They can be transmitted by sexual intercourse, and then also from blood transfusions as well. So some of your diseases that are caused by bloodborne pathogens, they are your hepatitis B, your hepatitis C, and your hepatitis D. You have acquired immunodeficiency syndrome, which is AIDS, malaria, syphilis, and then Ebola. And hepatitis and AIDS pose the most occupational risk to healthcare workers, so keep that in mind. So OSHA has determined that there are certain standards that facilities should take to prevent bloodborne pathogens from being spread. So they have decided that employees must receive training on the risks associated with bloodborne pathogens and on the methods that they can use to safeguard themselves. Employers must make the hepatitis B vaccine available to workers who are at risk and free of charge. Employers must provide adequate personal protection, PPE, as required by the employee's duties. So outside of each room, if you're taking care of a patient that has a bloodborne pathogen that can be spread, they have to make sure that they provide you with the PPE to safely take care of these patients. Environmental control methods such as a special ventilation system, them negative pressure rooms we talk about, procedures for the disposal of liquid waste, and procedures for handling contaminated linen and trash must be in place to protect both the employees and the patients or the residents. And then an updated exposure control plan must be in place in case if an employee is exposed to blood or other body fluids from a patient to a resident. And every hospital has that. All right, so MRSA, VRE, and C. diff. These are your multi-drug-resistant organisms, okay? They are microorganisms that are resistant to one or more antibacterial agents, antibiotics, that are commonly used to treat these infections. So over time, what happens is some types of bacteria have become resistant to certain antibiotics. This means that the antibiotic will not work to treat that bacteria. Another antibiotic will need to be used to treat the bacteria, but MDRO infections can be difficult to treat because they are resistant to certain antibiotics, which are the best antibiotics to treat that infection. So one of those infections is MRSA, methicillin-resistant Staphylococcus aureus. It's an infection often acquired in healthcare facilities. So Staph aureus bacteria are normally found in your nasal mucous membranes. It's found on the skin and in the respiratory and gastrointestinal tracts. Approximately 1/3 of the people in the United States are colonized with staph, meaning the organism is present in these locations, but the person doesn't have symptoms, and they remain healthy and unaffected. They can, however, pass this organism on to others. Then we have VRE. So VRE stands for vancomycin-resistant enterococcus, and enterococci are bacteria that live in the GI tracts and the genital tracts. And then like we spoke about earlier, you have your C. diff, which is a spore-forming bacterium, which can be part of the normal intestinal flora, and it produces a toxin that causes that watery, contagious diarrhea, and you have to wash your hands with soap and water. So your aseptic technique, we talked about this before, I think. It includes all activities that prevent or break the chain of infection. So the practice of asepsis includes preventing that infection. That's what we want to do. We want to break that chain. The nurse uses aseptic techniques to halt the spread of the microorganisms and minimize the threat of infection. So you have your medical asepsis, or you also hear it called as your clean technique. This involves procedures and practices that reduce the number and transfer of the pathogens. And medical asepsis procedures, including performing hand hygiene and wearing gloves. Then you have your surgical asepsis, or what you'll hear called as sterile techniques, includes practices that are used to render and keep objects and areas free from microorganisms. So surgical asepsis procedures, you'll find them when you're inserting urinary catheters and when you're inserting IV catheters. You want to be sterile. So use of sterile asepsis. This refers to the use of precise practices to eliminate all microorganisms from an object or an area and prevent contamination, also known as sterile technique. We use sterile technique in the operating room, labor and delivery areas, certain diagnostic testing areas, and at the patient bedside. For instance, if we're doing a catheter insert on a patient, sterile dressing changes, or preparing and injecting medicines, you have to use sterile technique. So practices that maintain a sterile field. Prolonged exposure to airborne microorganisms can make sterile items non-sterile. You want to avoid coughing, sneezing, and talking directly over a sterile field. So once we get into lab, you guys are going to learn sterile technique, and you're going to learn and be tested on inserting catheters and how to maintain that sterile field. So we will learn more about that. Then only sterile items may be on a sterile field. You want to make sure when you're opening sterile products that you use the outer wrappings, and we consider like a 1-inch border that encompasses the entire package. That contains sterile items that are not sterile. You want to touch sterile materials only with sterile gloves. You want to consider any object held below the waist or above the chest becomes contaminated. So you want to have a certain area where your hands go, not below the waist or above your chest, because then it's contaminated. Sterile materials may touch other sterile surfaces or materials. However, contact with non-sterile materials at any time contaminates a sterile field, no matter how short the contact. And then any sterile non-waterproof wrapper that comes in contact with moisture is also at that point non-sterile. And then you want to discard any sterile packages that are torn, punctured, or are wet, because then they would not be considered sterile anymore. So patient teaching for medical asepsis at home. What do we want to teach our patients? So remember, medical asepsis is just that clean technique. It's not sterile. We want to teach our patients, we want them to wash their hands before they prepare or eat their food. We want them to wash their hands and prepare their food at high enough temperatures to cook off any bad bacteria. We want them to use care with cutting boards and utensils. We want them to keep their food refrigerated. We want them to wash raw fruits and vegetables really good. We want them to drink milk that's pasteurized and only have fruit juices that are pasteurized. We want to encourage them to wash hands after using the bathroom. And then we want to encourage the use of individual care items. So you don't want two patients sharing the same hairbrush or body wash. You want each patient to have their own stuff. So evaluating patient goals. Oh, we just did that. Hold on, I clicked the wrong one. Sorry, guys. Actually, okay, I think that slide is there twice. I have to remove that. I apologize. So every hospital needs to have an infection control plan, okay? Your plan must include an infection control committee, which all hospitals have, surveillance of nosocomial infections, someone that's monitoring these infections and working on ways to prevent them. You need to have an employee health program, which every hospital has, and then you have to have isolation policies, which every hospital has in place, and you will learn them when you are hired, and you have to consistently take competencies each year, which keep you up to date on the latest and greatest evidence-based practice. So that is the end of this lecture, and we are now going to start vital signs. If you guys have any questions, we will go over this in more detail during our live lecture.